So we went out and asked, what was your most memorable clinical experience?
Well, back in my second year, I had a cancer patient, and they were neutropenic. And then they weren't able to interact with the family member in the way that they were used to. And I got to really kind of connect with the patient. And like they opened up a lot, and that was really sticks out in my memory. I remember that today as being a really positive experience.
I would describe it as positive. I've been lucky. I have had really good mentors that have supported me and tried to increase my confidence in my clinical skills. I personally tend to need someone that pushes me and that doesn't give me easy, that pushes me to learn more. And so far I've had that.
The best clinical experience I've actually ever had was actually when I was at Midland. I was doing shadowing in the ER and got to experience a diabetic ketoacidosis trauma that originally came in as just a standard hyperglycemic reaction. Really had to think quick on our feet, so we ended up having to do a lot of the different work. So the doctor was in the trauma room and yelling out orders such as he wants 5 nebs on this patient, he wants sodium bicarbonate mixed with B50, he wants a push of sodium bicarbonate, really trying to solve the problem. And his comment to me was, your patient's dying, better learn quick. And that, I think, was one of the best clinical experiences I had, because it made me realize, A, you're there to save your patient's life, B, you have to think on your feet, you have to be able to be flexible in that, and see just the passion that and the adrenaline rush that it gives you when you're in a situation like that is, for me, enjoyable.
Nice. My positive clinical experience would be, I guess, the nurses on the floor and them including us and accepting us and stuff, and then also having a good mentor or CCD and good members of your clinical group.
I think the most memorable clinical experience that I had is on the rehab floor, my first clinical that I ever had, because the patients were there the entire time that we were there. So it was nice to see that my first patient with my first week was actually rehabilitated and went home by the time that my last week was there, and it was nice to know that I actually helped to do that.
Okay, yeah, so I had a really memorable experience. It was actually on the cancer palliative unit and so I had a patient hemorrhage, but what happened was, so I was working with a nurse, and then I had completed my task for my 2 patients, and I was trying to fill some time, and I went over to her and asked, hey, is there anything else I can help you with? And so she actually said, yeah, I just need a brief change done in this room. So I agreed to do it, and she pulled me aside and said, by the way, don't be alarmed, she has a little bit of rectal bleeding. And so I was aware of that. Okay, thank you. Off I went. And when I walked into the patient's room, the patient was talking to, it was actually her daughter, and they're chatting away, and I just said, oh, I'm here to clean you up. Do you want me to give you a moment? And she was like, oh no, my daughter was just leaving. So the daughter got up, said her goodbyes, and left. And then the patient was chatting away with me, and I made sure to get consent. Okay, is it okay if I change your brief and clean you up? And she said, yeah. So I began that, and what happened was, when I opened the brief, there was a lot of bleeding. So although I was warned about a little bit of bleeding, I noticed right away that this was pretty excessive. Next thing you know, the patient went unresponsive. So I was calling her name, shaking her, I did the sternal rub, and then I did the pupil check, and she was completely unresponsive. So at that point I knew this was an emergency, so I hit the staff assist button, and that got the healthcare team in to help me. So basically we got blood pressure cuff on her right away, took vital signs, and she was hypotensive, and I let them know right away, this patient's unresponsive. I believe she's hemorrhaging. I did a pupil check and it was unresponsive, non-reactive to light, and so we were able to really help this patient. And through that quick thinking and calm reaction in the spot, it really helped get the help that she needed promptly. And then she ended up getting 2 units of blood, a unit of platelets, but at a fast infused rate. And she was stabilized and sent off to the ICU, which was a good outcome.
That's pretty interesting. I wish all my placements were like that. Just kidding. Thank you.
I would say my most memorable clinical experience, I was in my second year, and I was at Cancer Palliative, Georgian College, and I had a patient's wife who was asking questions and not getting answers. And I sat down with her for about an hour and I answered the questions she had about her husband and everything. And at the end of the day, my mentor came out and gave me a letter that she had written saying nice things about me. So that was really impactful on my outlook on the program, and it's been an inspiration to keep waking up and going to clinical and staying up late and studying and working hard to get through it. What advice now would you give to first year students before going into clinical?
Like if we're oriented to the floor really well, and then also introductions to people, but I find that being proactive, and when you get on the floor, if you say, hi, I'm Andrea, I'm a nursing student from York in year 3, and through being proactive like that, it's showing that I want to be here, I want to learn.
So taking charge of your learning, basically.
Definitely.
And what would be a piece of advice for a first year nursing student that hasn't done clinical yet? Do you have any piece of advice for them?
Yeah, so I would say be open-minded and definitely being prepared through having your cue cards ready and any homework done, because clinical is so unexpected. You just want to be on your toes for anything that can happen, but don't be overwhelmed by it because you have lots of help there when needed.
That's good.
I would just say that, you know what, use every hour, take it to your advantage that you're here, because it really is a great opportunity for you to learn.
What I would give to a first year coming into this program would be to focus on like assessments and like all the normal values and stuff, so that you can, by knowing that, you can understand more everything else related to the program, like the medication and all that. Yeah.
My piece of advice for first year students would be to put 100% in. Really commit to the program. It's tough at the start, it can be tough in the middle, it can be tough at any time really, it can be easy at times too. But if you're always giving it 100%, you'll pass and you'll get out what you put in, and I think that's what makes it rewarding, and that's why you could commit for the 4 years and really want to be here and be a nurse.
Exciting.
It gets better. The first semester is really just theoretical based, but that's also because we're dealing with humans here. We're dealing with a person's life and a person's well-being. If you think that it's always going to be like that, it's not going to be. And then you do second semester and you're kind of in the clinical setting. You don't really have, that much freedom. You have a mentor like down your neck the whole time because they're worried that, you might mess up. Then you get years and years above and you realize that oh wow, I'm actually a nurse.
But take the good with the bad. You'll see a lot of nurses that maybe don't have the practice you think that you'll have, and learn from that as well. And that it's a lot of work, but the clinical experience will show you that it is what you want to do, and to just, I guess, keep pushing through.